In the moment, when put under pressure, we're all capable of being leaders if we're in the right spot and available and willing to work.
I had to step into a role where I had to support everyone else. So it almost is like you realize that you don't feel strong or confident, but you have to step into that place of being the one to comfort everybody else. That's probably the hardest thing I've had to do in my life.
I do give leadership thought. I do think about it a lot because I think it makes you a better leader.
I would say, a lot of what you use in this crisis or a pandemic situation are many of the same skills and tools, arrows you have in the quiver that basically you've used in other leadership positions over the course of your career.
I don't think that what makes you a good leader overall is any different than what makes you a good leader in time of crisis, right? Like I think the principles of communicating well, listening to people, making values-based decisions, and knowing yourself and how you respond to stress is really important. I will say that probably one other thing, I don't know where this fits into your framework, is that prior crises, I think, prepare you in some way.
I have been through other crises, none as big as the COVID-19 crisis.
We had a lot of issues to deal with when I came on as interim chief.
We've had miniature financial crisis before. Several years ago, things got a little tight. We had to make some adjustments.
So my first year of serving as chair was in the midst of a major recession at Michigan.
There are no shortage of financial crises that come up, physician staffing, faculty turnover, that over the course of my career, I've been tasked with trying to navigate and manage to the best of our program's ability to do so. So
it was 2018 where we were renegotiating the nursing contract, and we were told any day now that we'll hear from the nursing union, and they have to give us 10 days, but we have to shut down the hospital. And so we've sort of similar to this, had to come up with really quick, thoughtful models and plans to, what would we shut down to? Let's model that. How many beds, how many staff, where would we get this staff? We could get nurses in from around the country. How fast could we get them in? And so that was like a drop everything, all hands on deck. And so that work really prepared us insofar as we had done a lot of the sort of, Armageddon level planning and gone through a lot of the hard discussions. And so it didn't feel completely novel to consider some of these things. And we were actually able to dust off a lot of our plans and say, we know this isn't a work stoppage. We're going to have lots of nurses. We just this is going to be a different kind of pressure, but a lot of the principles and work was consistent.
I think it's all those collective sets of experiences that you draw from in a situation like this.
So I'm pretty sure there's absolutely nothing that can prepare you to be a leader during a pandemic. But I will say, when thinking about this, I realized that there's kind of one thing that does prepare you a little bit for this, and that's actually being a clinician, specifically during a clinical emergency. When you run a code, when a patient's heart stops and an entire team of people run into a room, the easiest thing is that everyone in that room knows what their goal is, and their goal is to somehow get that patient's heart to start beating again.
The pandemic created some, a sense of urgency and a sense of team that, maybe we don't always remember in kind of everyday life, but it did create an opportunity to kind of break down some of those, traditional boundaries or barriers or even, personal difficulties, because everybody ultimately wanted to help.
So a lot of the silos have been broken down.
And so probably the best part about the whole experience was meeting the different individuals that I otherwise probably wouldn't have crossed paths with. kind of engaged with this common, gigantic ask that felt really hard, but the amount of progress that we made over the ensuing weeks together was just so remarkable.
Even though it's been a crisis and there's been a lot of bad that has happened, there's been a lot of good that has come of this in regards to our ability to respond. We have emergence of new leaders within the division and within the department in Michigan Medicine.
And we had some tremendous engagement from people and phenomenal plans. I mean, the whole layout, and the reality is we should have a surge plan that includes an offsite emergency department, includes ancillary offsite medical care facilities, for whatever, a disaster at the stadium, another infectious disease disaster, a huge weather event or tornadoes that come through here. It's taken us years. We've never had plans to the detail that we have now.
We've learned new ways to care for patients that we didn't do before. I mean, virtual care. We were given a mandate to increase or to have 10% of our outpatient visits be virtual by 2022 or 2023. And people were rolling their eyes at the ability for us to accomplish that. They thought there's no way we could do that. Right now, 90% of our visits are virtual. And 90% of our providers know how to do virtual visits. So we've learned a lot in this crisis, and it's not all bad. There are some good things that have come of it.
Crisis kind of tells you and shows you, how high people can rise. And I think I've been impressed by everyone I work with that people have been really able to rise to the occasion.
We had to engage really all levels of Michigan medicine, and the altruism that we saw exude from our employees at all ranks was really powerful.
And some other new people came out of the woodwork who was like, I can do this. And you say, okay, great, go to it. Empower them, and just give them some general guidance and let them go.
And I think that leadership happens without a title. I think that we lead a lot by influence rather than roles and titles.
I don't have to convince them to do things. I literally will ask them to do things. And then think of it as, not I'm asking you to do it. I'll be there with you. We'll do it together. And that's been very powerful for me.
Effective leaders learn is how to manage with influence as opposed to kind of line authority. And so thinking about how it is that you influence decisions, influence how people react in certain situations, influence how people consider what you're saying in light of the other things. I think that's a very important skill in leadership.
I also, had the realization very quickly that this was not something I could do by myself. This wasn't like, the operating room where I can kind of control the microenvironment and the team. This was going to be a team sport, a collaborative effort, and my ability to be successful in that role was going to be completely dependent on who my partners were in that initiative and how well I collaborated and communicated with them. There's a great Casey Stengel quote. So Casey Stengel was one of the managers of the New York Yankees back when they were the Bronx Bombers. So he managed, Babe Ruth and Lou Gehrig and those types of players. And when someone asked him what the secret was to his teams, he said, I think the PG version is, go out and find ball players and then give them the damn ball. So in other words, get out of their, show them the challenge, get out of their way and let them do their job.
You need to make a decision about whether you get more satisfaction out of helping someone else succeed than in doing that yourself. In other words, if you'd rather be the famous player or the coach of the famous player. And so a leadership thing is not about being the star. It's about being the coach.
This sense that you're burdening other people with assigning responsibility to them. And that is generally not the case. They seek out responsibility and want to step up. And so it's really a mindset to say, you've got really good people who want to help and are capable of helping. And with helping, they are learning. They are gaining experience in how to be leaders.
You can tell people how to do stuff, and then you're going to be managing the details of if they're actually doing it the way you want them to. You can tell people what you want done, and then you're kind of managing, are they accomplishing, what it is. Or you can ask people, you can tell people, these are the things that we need to achieve. You can get people working towards those achievements. And that, I think, gets you a much different level of engagement, much different level of problem solving, because if you're back to this is how to do it, all you're going to get is what you can best think of yourself as how to do something. You ask people what you want done, you're just going to get the best of how you would think about doing it. If you say, these are the things we need to achieve, let's achieve these, you're going to get a lot better and diverse opinions and solutions on how to achieve those objectives, as opposed to we're just doing something this way or we're getting this kind of a thing done. And I think we saw examples of that through the command center as well, where we would say, look, we need a function that does this, and then people went and figured it out. I think the mask reprocessing is a good one, right? We said the problem is, we're burning through too much PPE. What are ways that we can conserve masks? And so conserve PPE. We had people think about that. And they came back with, well, we can extend the use. We can have people wear the single mask longer. We can have them wear a mask over several days. And you have to do this. Or we can start reprocessing masks. And then they went down the pathway of how do you reprocess them and which one did they choose and all of that. And so really kind of saying these are the things we need to accomplish, and then letting people come back to you with how best to achieve those results, I think can be a more effective management strategy.
So what that required was a lot of work, a lot of sharing, vulnerability, which sometimes as leaders, we don't want to be vulnerable. We sometimes feel that we need to be strong and push through, and then others will follow. But people need to know why they need to follow you. They need to know what your core is about.
And I've told everybody in the department, part of the organization, that I come to work every day with a lump in my throat, because I know they do too.
Being transparent and willing to admit strengths, weaknesses, fears, but also being willing to put yourself out there will go a long way. So I think it's okay to say, like, I'm really scared to be doing this right now, and I don't know what I'm going to do when I get home about keeping my family safe. Probably is very meaningful to the sort of group of people around you who you're leading, who are having the same concerns. And so hearing that, like, we're all going through this, but I'm also willing to go into that room and be with you and do that procedure.
That feeling of being part of something bigger than you is such a powerful thing, not just as a leader, but as a person who is experiencing the pressures around you. So this sense of belonging and, sort of really feeling like you're joined together in a way that's much deeper than just your title, your role, your responsibility. Whether it's the marital ties at home and the paternal ties, or whether it's the sort of job ties, that's really what I think defines who you are as a leader. It's not what you say, it's what you do, right? And I think that has been this constant force in my life.
People will often say, oh, you got to make sure you listen to your frontline people and stakeholders. And I think that's crucially important.
Being a good listener is sometimes the hardest part, but we need to take time to listen even as leaders.
And one of the rules is called watch your TLR. I don't know if you guys know what the TLR is. No. The TLR is talking to listening ratio. And I am convinced that good leaders listen more than they talk. In the context of a crisis, or in the context of someone not having a good day, your job is not to talk a lot. Your job is to listen, right?
But I think more important is making people feel heard. So I can sit here and say, oh yeah, I'm listening to all four of you. Which is necessary but not sufficient if you don't make people feel heard. And sometimes that means you have to be visible and see and be in touch with what people are wrestling with.
You're there so that people know that there's a ear that's kind of like bent forward and hearing what you have to say. Because I think the most important thing in leadership is really listening more than talking.
One of the best skills, I don't know if it's the most important, but one for people to certainly consider is self-reflection. And that is looking back on how you think you performed.
It's about doing the messy work, the disciplined reflection around learning about your weaknesses, doing 360s, hearing about where you need to change. And
I think this is true on a clinical basis, this is true on an interpersonal basis, this is true on a leadership basis. But to look back objectively and fairly, but with some level of critique and criticism on either how you behaved in a circumstance and that either promoted success in that or did not.
Pushing yourself to be more humble about your capabilities, to be more courageous about confronting your weaknesses.
Or, and to think about kind of what you could have done differently or how you could have managed that differently. And then to kind of distill that into either practices or principles that you would use going forward to be more effective.
It's not reading a book and then forgetting about it. It's like living in the book and like carrying it around and figuring out who's doing what and living the frameworks.